I'm super happy to be able to do this. This is really for me, but you guys are going to enjoy the benefit of it too. I'm welcoming Dr. Milton Little to the podcast today. This is, thank God, somebody I met who really, I mean, you put me back together, and I'm so fortunate that it was you. So when I got injured, which like everybody who watched my podcast knows about, you know, I told you this, I told other doctors that I went to a still to be named hospital that I told myself I didn't want to be in. And I left. Then I went home, which I learned was stupid.
Yeah, I don't understand how you did that.
Okay. I didn't sleep very well. And then I went to another doctor who was like, "What are you doing here?" And he was like, "You need to go to the hospital." And then he was looking at my injuries, and he'd seen the images and x-rays from that first hospital, and he goes, "You know what, who you really want to do this operation is Dr. Little." And I was like, "Cool, can I get him?" And he was like, "I don't know." He's like, "I'll text and I'll see if I can get him for you." And then it was just, I just had your name in my head, and I went to the hospital, and every time somebody from the orthopedic team would come in, I'd be like, "Is Dr. Little going to do this?" And they were like, "Oh, you know about Dr. Little?" I was like, "Yeah." Like, because, I mean, and then I fortunately got to have you perform these surgeries, which we'll get to in a moment. First of all, let's just acknowledge what a high achiever you are. So you are not only, because anyone who's a doctor, I mean, we all grew up being like, doctors are the best of us. They're the smartest. And you not only are a doctor, you went to Stanford, where you also ran track. Yeah, so you were like, being a real smart guy is not enough. I'm also super athletic. So I always wonder this about people that achieve so much. So I assume in grade school, high school, you were probably an A student, right? You probably
I was.
How much of it, because you usually see like it's some combination or one or the other, is like you being driven, and how much of it was like parents being like, "You're going to get good grades." Like, is it a combination of the two?
Oh, it's definitely a combination, right? So I come from a family. My mom's a retired principal now, but she was a teacher forever. Mm-hmm. My mom's mom was a teacher. My dad's mother was a teacher. Wow. One of my aunts a teacher. My dad he works for a nonprofit, so he now works for the United Way in Atlanta. So he was always working for kind of improving things for people who were less fortunate.
Yep.
My maternal grandfather was a family practice physician. He was one of the first black doctors in a town called Ypsilanti to actually have his own practice.
Wow.
He actually delivered my stepdad and all of his siblings.
Whoa.
So, I think they kind of set a bar for you to,
sure,
you have things that you need to accomplish. And, there was never pressure from them like outwardly, other than knowing that I would get in trouble if I didn't do my job or handle my business. Mm-hmm. So I always kind of had it in my mind that if I do well, if I work well in school, then, it'll pay off in the end.
Sure.
And I think probably the thing that was one of my biggest motivators was the fact that we lived with my grandparents for a year in Ypsilanti. And so if you've ever, Ypsilanti, Michigan is like just outside of Ann Arbor. It's a small town. Mm-hmm. And like I said, when he delivered my stepdad. So if you go to the major store, which is Meijer, mm-hmm. You're going to run into people who my grandfather has either delivered or delivered their children. Like,
wow,
every time.
Wow.
And my grandmother was a teacher, but she tutored kids in the neighborhood. She, ran some of the Girl Scout troops. So they were really like members of the community who were always involved. Mm-hmm. So like you see their impact on the community, and you're like, well, all right, I guess I'm I have to do something with my life.
I mean, it's a super cool story. It's also, I think part of like hearing that makes me go, oh, that you have to credit someone's environment a bit to like them being like fostering the good habits and the encouragement and like, look what can be achieved, because
it's a big, I think it's such a huge deal when you see people who look like you who are doing things like that, right?
Yeah, sure.
When you have them as tangible examples of life.
Yeah.
And so I think that was a big part for me. And then, when you ask, is it something intrinsic, when I went to public school, we moved around a bunch, but eventually ended up in LA. So I went to, we lived in Echo Park from 88 to like 93. So late 80s, early 90s.
Yeah.
And then from there to the Valley. And I went to public school my whole life up at that point. And an assistant principal at our school had talked to kids about possibly going to boarding school. So, I filled out applications and kind of got a scholarship without really talking to my parents.
Yeah.
And then came to mom and was like, I think boarding school would be a good idea for me because I think I need a little bit of a kick in the butt.
Really?
And, her.
You felt like you needed that?
Yeah.
Really?
And so her and my dad, and my stepdad and my stepmom kind of scrounged together, money for me to go visit. And then from there, they, I ended up getting the scholarship to go. And so it was just, that kind of was the thing that really also changed my life.
Going to that boarding school?
Yeah, big time.
And where was the boarding school?
Rhode Island. So it was a small school called Portsmouth Abbey in Rhode Island. And so, for somebody living in LA and New York their whole life, and then, small town Ypsilanti.
It was Harlem, right?
Yeah, born in Harlem. My dad was always in New York, so I was always back in New York for Christmases, for holidays, and Portsmouth was a little different speed.
I bet. That's not Harlem or LA.
It's not Harlem, it's not LA.
No.
So, I and then you credit the people who were there with you.
Yeah.
I have some of my closest friends who I am still extremely close with and still talk to regularly.
Yeah.
Who, were from the city, who I spent time with in the city, So.
And how much time did you spend in that boarding school?
So I was there from sophomore year to senior year.
Okay.
So like the crazy thing is when I got accepted, the assistant principal at my middle school was like, oh yeah, he's probably going to need to do another year. So he's probably going to have to repeat a year.
Really?
Yeah. And I was like, no. And because, that was just, they didn't know how I would handle.
Yeah.
But someone told me that, which was good because that was like one of those things that was a chip on my shoulder. And I was like, I can guarantee I'm not going to have to kind of repeat that year.
Yeah. Yeah.
And so, it was a motivator. And
to really achieve.
Yeah. Exactly.
So you talk about, it's funny, the importance of seeing people like representation basically, which is something I feel like you learn more as you get older when you're white. You're like, oh, yeah, I'm just used to everybody looking like me doing things.
Yeah.
And then I go, like, the older you get, you're like, oh, like, to like, especially like a young kid seeing like a black doctor being like, oh, like I could be that.
Yeah. I mean, for many people, they just literally do not think that is an option.
It's crazy,
You know what I mean?
right?
It's like, well, no. Or I mean, for me, I got lucky, right? I had a black first grade teacher.
Mm-hmm.
When I was in Michigan, and my kindergarten teachers were black.
Yeah.
And then but after that, until high school, all of middle school, I didn't have any black teachers.
Yeah.
After first grade, I didn't have any black teachers in elementary school. But, I grew up in education. So
right. So you were used to that.
I'm used to
it.
Yeah. So it was not like this strange thing.
I always remember that, before Obama, there was this movie with Bernie Mac and Chris Rock, where it's like a joke about a black guy becoming president. Everyone's like, that's hilarious. Yeah. And then I remember I opened for Tommy Davidson one time, and that was like one of his big bits. Was he's like, I'm gonna do an impression of the first black president ever, and he would walk up and grab the mic and go and fall on the ground, and the place would fall apart, and he'd be like, just kidding, there'll never be a black. Like it was a joke.
But that's the greatest. Like that's one of the greatest Richard Pryor skits of all time.
The black,
right? The black president skit.
Yeah.
And then Dave Chappelle's version of it.
Yeah, and everybody has like a version of it. Yeah.
But it's.
But then a kid who's growing up in 2005, 8, like that in that time goes like, oh, it's just
the president.
It's the president. Yeah. And then it normalizes it to them.
To some extent.
Well, yeah. I mean, look, there's not going to be another one for a while, just so you know.
Normal. Yeah, to an extent.
Yeah, to an extent. They'll be like, we got one in 100 years ago. That's a lot of time. Yeah. So, all right. So not only are you academically super, but then you also, weren't you a broad jumper?
I was a long jumper. Yeah.
Long jumper.
So I was a long jumper at Stanford. So I did a bunch of sports.
Come on.
At high school.
Yeah.
And, the length that I jumped in high school was pretty, I jumped 21.9, which is not particularly far. It's not far for a real high school, like
Elite
elite high school athlete is not that far. An elite high school woman will jump that far, or further.
Wow.
You know what I mean? But for an elite male athlete, it is not far at all. So I go to talk to my coach, this guy named Edric Floreal, who is the greatest long jumper, triple jumper in the history of Canada. He's the head coach at University of Texas. He's like one of my biggest mentors of all time. So I go to talk to him and I'm like, these are my times, blah, blah, blah.
Yeah.
And he's like, okay, kid.
Yeah.
So I hear nothing from him, nothing, but I call my high school coach and I'm like, can you give this guy a call, please? And so he calls him and he's like, all right, well, show up to this workout. So it's this stadium workout at the old Stanford Stadium. It's this old, it used to be an Olympic stadium, and it's just like a giant football stadium with all of these stadiums, the stadium seating and hills and whatnot.
And at this point, are you like a freshman?
I'm a freshman. I'm literally, it's like first couple weeks at Stanford. And
Okay.
So I'm a freshman. I show up and I'm from New York and, I'm wearing Timberland boots and jeans and I have shorts under my jeans, like basketball shorts under my jeans. I borrow a pair of shoes from my roommate. And I'm like, okay, I'll do this workout. So he sees me come down this hill on a bike with Tim's on. I take off my stuff and he's like, who is this kid? He's like, this kid is nuts.
Yeah.
And
you can do these in Tim's?
Yeah, he's like, are you going to stretch? So I'm like, lean on, now that I'm about to be 40 years old.
Yeah.
Doing something like that without stretching, I'd die.
Yeah.
I'd probably just I'd fall.
Oh yeah. I almost did.
So I
didn't stretch that down.
I lean, stretch a little bit, and I do this workout. And, it's with members of the team.
Right.
And so I'm doing this workout with members of the team, and I'm just
casually going through it.
Keeping it up with everybody and doing well. And he's looking, and there's another guy, the throws coach, a guy named Robert Ware is there as well. And he's like, this kid is crazy. He's crazy. He's absolutely bananas. I don't understand why he's keeping up. And so I just...
So obviously you're in really good physical condition.
I guess.
Yeah.
I mean, I was, once again, you're 18 years old. It's
18.
It's all right, what do you want me to do?
You can also you can drink a bottle of whiskey and be like, I'm fine the next day. No. Yeah.
So I finished this workout and he's like, okay, come tomorrow. And so I make the team based on one workout.
What?
And we probably spent the first 4 months of me on the team just trying everything out. I ran hurdles in high school. I did long jump and triple jump in high school. But like I said, the times in
does it become clear to you that long jump is your best event, or to them?
It starts to, right?
Okay.
It starts to become clear that jumping is probably going to be the best event, or we can put this guy in a relay because he's kind of psycho, or he's kind of he'll just run hard. He'll run through a wall for you.
He'll do it in Tim's. It's crazy. Yeah.
So so I start long jumping, and the crazy thing is, I start long jumping, and within my first year, I jumped 21.9. In high school, I ended up jumping 23 something by the end of first year, and it's a decent time. It's a decent length. It's a early young person competitive length for kind of college.
Okay.
And then life happens, and I keep working. And my sophomore year, I end up jumping 25.8, which is I'm top 15 in the country in NCAA. And things just kind of work out where I become a member of the relay team. I become a pretty good Pac-10 long jumper.
Wild.
I win Pac-10s my junior year of college.
Wow.
I'm captain of the team my junior and senior year. I jump at Olympic trials. I sucked at Olympic trials, but I jumped at Olympic trials. And
look, you went to Olympic trials.
So
how about that?
It was just and I spent a year at Stanford coaching track with him.
You did?
Yeah. So in between, after I finished undergrad, I spent a year at Stanford coaching track and doing research and applying to med school.
What's your best long jump?
So my best long jump is, 799 or 26.4, I think.
26.4.
Yeah.
So but between finishing high school and that best jump, you increase it by like 6 feet.
Yeah, basically.
Which
is crazy.
Yeah.
Which has been it's
and that's like training.
Yeah,
technique.
that's training, having a technique coach, having somebody who knows what he's doing.
And you obviously got stronger.
I got a lot stronger. You're doing like weight training.
I told you my dad did long jump.
Yeah.
And he was like, ask him if he ever got 20 feet. And I was like, okay. And I asked him, he was like 26. I was like, he got 26. He was like, oh. I was like, yeah, it's a little further than you thought.
So that's how I end up like long jumping.
It's wild.
Yeah.
That's one of those events too where, you know, it's not covered every night in Sports Center.
No,
so like you could have been like, I jumped 15 feet. I'd be like, wow, I have no idea, you know, how far that is. But it's also it's an incredible accomplishment. So 26.4 is that you said?
26.4. Yep.
That's elite, right?
Yeah. So I at the time that, you know, that jump put me in like top 10 or 15 for the country that year.
Wow.
Actually a little bit, like probably about top 10 for the country that year. So I should have jumped a lot further at trials, and I just
it sounds like when I think about it, it's like 20. I'm like, wait, that's like a fucking semi truck. Like, what are you talking about? How the hell did you jump that far?
It's fun, and you know, I have to give give credit to my wife for always like keeping me like down.
Oh yeah, they're good at that.
Yeah, my wife Erica, and you know, I have 3 kids. Joy, Elise, the oldest, Miles and Langston, and I have to say their names or
of course.
I will get in a lot of trouble.
Of course. But,
you know, one day they were like, well, show us how far you jumped, Dad. So I like step out 26 feet and she looks at me, she goes, you're lying.
So was she with you at the time?
No. Okay. So my wife and we met freshman year of college.
Oh, you did?
Yeah, we met. So she went to Stanford.
Someone else who's very smart.
Yeah. So we actually met at this thing they call Admit Weekend, which is like this, anybody who gets admitted to Stanford, they have you come in for a weekend and just to kind of experience what it's like being there. So I meet my wife at this weekend, and like I'm very shy and quiet, but like she's extremely beautiful, and I'm in love with her immediately.
Really?
Yeah, immediately.
That's awesome.
So, but I do not contact her at all.
Right.
So like, cause I'm like
you're shy. I'm shy.
Yeah. So I decide I'm going to Stanford. She is like early decision or something, so she had to go there. So we end up at Stanford at the beginning. We hang out like thick as thieves. We're friends, and then we start dating by like October of freshman year.
Oh, that's pretty.
That's pretty quick. Yeah, school starts early September, late October, early September, like late August. So we date for a couple years in college, break up, and kind of live our own separate lives, and then. I think my right before my second year in med school, she and I start kind of talking again on the phone, and like I tell her I still like her. I'm still in love with her. She kind of agrees, and we start dating long distance for about 6 months. And next thing you know, so in 2000, she moves out to Michigan for grad school. She goes to Michigan for public policy. There for 2 years, and then we get married in 2009, and the rest is history.
Yeah, that's a great story.
It is. It's kind of a lot of good stories.
Yeah, it's a good story, man. So let me ask you, I'm always fascinated by this. So you go to University of Michigan med school. Whenever you see a doctor, particularly a specialist of any kind, some part of your brain, like as a patient, always goes like, what? How'd you pick this? Like, you know what I mean? Like you start like, you're a fucking podiatrist? Like, or like, urologist. You're like, you just hold dicks all day. So like, but, when I'm in the hospital and I have these injuries, I go, I remember like one of the doctors saying, you're going to see one of the best trauma surgeons. Yeah. So I was like, okay. And then immediately, I met you and we're talking in there, and you have great bedside manner, by the way.
I appreciate it.
Yeah. You come in, I was like, who's this kid? Like, you look like you're fucking 22.
That's what I was going to now.
Oh, man. I was like, this guy? So you come in and you have like great bedside, but then I never got to ask you, so you're in med school, do you figure out, like, I want to do, like, how do you figure out you want to do this? Because you're doing like...
It's really hard. It's a really hard decision. So, at Stanford, when I did my research, I did research in neurosurgery, and then I also did research in pediatric cardiology. So, taking care of kids' hearts.
God.
So I do research in those things when I'm...
Dude, I wrote a fart joke today.
So I do research in those two things.
Uh-huh.
And then I get to med school, and you go to med school, and your first 2 years, you're literally, it's like going back to high school. You sit in this same room every day, and you have lectures about like science.
Yeah.
And it's just lecture after lecture after lecture. You it starts to get some like clinical exposure, meaning they're like, oh yeah, you see this sciencey thing?
Mm-hmm.
In orthopedics, we talk about it in this situation. And like, it's like, that's it. So you don't really get to meet people, but then they start to have these things called interest groups where an attending or a surgeon or, medical doctor comes in, has people come and, they talk to them about the specialty and, like, oh, is this something you'd be interested in? So a guy named Cliff Craig. So like I said, another mentor, like every single step in your life, you're going to meet these people, right? So Cliff Craig was my mentor, and he gave the talk on orthopedics as a subspecialty. And I'm like, oh, this guy's he's a nice guy.
Mm-hmm.
He seems like an interesting person. And so I spend a summer doing research with him.
Okay.
At the same time I'm doing this research, he lets me come and scrub into cases in the operating room. I'm in clinic with him. I'm rounding and taking call with the residents in orthopedics. So I spend all this time with these guys, and I'm like, this is amazing, right? So it's this idea of,
so that it blew you away.
It blew my mind because, there's a lot of there's one thing to you have diabetes, and then someone's like, yeah, take this insulin, and it's not going to fix your diabetes.
Yeah.
It's just going to like make sure you don't die. But it's, but you have to take it forever.
Yeah.
Versus, oh, you tried to dunk and you tore your patellar tendon and you broke your humerus.
Mm-hmm.
I am going to put it back together, and I can look at an x-ray beforehand, and I can look at an x-ray afterwards, and now it's fixed.
Yeah.
And now it's time for you to do rehab, and you can get better.
Yeah.
Right. And so that component of it was something that I thought was like pretty amazing.
You like the idea of being like, I'm going to like,
I have a tangible result.
And then this person, I'll put them together, and then they'll be able to.
Yeah. They'll be able to kind of get back to at least get close to doing the things they were doing before.
Yeah.
And so that was the exposure I got in med school. And so I'm like, all right, I want to go to residency in orthopedics. This is what I want to do. And so once you get to residency, then you still have like 8 choices to make, right? So if you think about orthopedics, you can be a pediatric orthopedic surgeon. You can be a joint specialist where you do knee replacements and hip replacements. You can do sports, take care of ACLs and things like that. You can do oncology where you take care of cancers of the bone. You can do foot and ankle where literally all you do is foot and ankle. You can do hand. You can do shoulder, elbow. Like there are all of these different specialties that you can pick.
Within it.
Yeah. And so then you rotate on all of them as a resident. So for 5 years, you're technically a doctor, but you really don't know that much. And you're literally learning kind of how to walk and chew gum at the same time. And so during that process is when you get those exposures. And one of the hardest rotations you do as an intern is your orthopedic trauma rotation, right? It's a rotation where you are taking care of people who come in on their worst day, whether it's somebody who tripped and fell, whether it's somebody who was in a car accident, patients, it can be a little old lady who broke her hip to a 25-year-old guy who was on a mini bike and got hit by a car.
And all these seem to be like, all these in particular seem to come with a sense of urgency involved too.
They do. They all have, obviously if you break your wrist, right, you can walk around, you can get your wrist fixed in a couple weeks. You can sometimes get it fixed with just a cast. You don't need surgery, but they all kind of fall under that window. And as a person, you kind of take care of that collection of patients. Yeah. And so my first mentors in orthopedic trauma were, Dean Lorich, who, was one of the best surgeons and kind of one of the best orthopedic minds I've ever been around. And Dean Helfett, who was his mentor, and they were at the Hospital for Special Surgery in New York. And Lorich is a tough guy. He was a tough guy. He was like a really hard, he's a hard-nosed guy who would hold your feet to the fire and push you like to your limits. Yeah. But I remember that, like when I first got there, one of the first things I did, I look at him in the face and I go, "Hi, I'm Milton. I'm the new intern, and I shake his hand. And like my seniors are like, what are you doing, man? This guy's crazy.
Really?
Like, yeah, because like it's one of those things where as the intern, your goal is just to avoid him.
Oh, I got
and stay
you.
away from him. And,
Yeah.
But from that, there were little things like, I could talk to him about cases. And like when I was an intern, I'd be like, oh, well, this came in overnight. What would you do for this? Or like, and, sometimes he'd like give me a thoughtful answer where he'd talk through it. And sometimes he'd be like, I just use my hands.
Yeah.
And you know what I mean? But like, there was something about the way he went about the process that really resonated with me. And I think that was a turning point. And you do that. Once I did that intern year, I was like, this is what I'm doing, period.
It seems like, obviously we need specialists in every field of this, but like the one that you chose feels intense. Like it is.
You know
what I mean? Like it's not like a casual stroll in, like, let's see what's going on today. So you shattered your leg. Like it's.
It is, but there's like, I think from an orthopedic standpoint, there's a few things that are going to wake me up in the middle of the night and make me have to like come into the hospital.
Mm-hmm.
There's only a few though. So probably like in a year, probably 5 times a year, 4 times a year.
Will you go in the middle of the night?
I have to go in the middle of the night.
What type of injuries are those?
That's somebody who has broken their pelvis that's so unstable that they may bleed out and die.
Wow.
That's somebody who has broken their bones and the bones have popped out through the skin enough where there's dirt and grime everywhere and it needs to be cleaned. Like that's somebody who has broken a leg and their leg starts to swell to the point where muscles or nerves may die.
Would Tiger's injury fall in that kind of category?
He's one of those people who are, that's one where you're probably going to go in the middle of the night or it's going to go immediately.
Because of what was reported, I think he ended up at UCLA.
He was at Harbor and then he ended up at Cedars and then.
Okay. But it was they said like a full like leg crush.
It's a bad injury. Yeah, it was a very, very traumatic injury.
Yeah.
And so those are things that, have some urgency to them.
Yeah.
A lot of urgency to them.
Yeah.
You know what I mean?
So you do you stay in love with this field as a resident? Like you're like, this is definitely the right choice.
It was
that's
like,
got to be something that happens too, right?
It does. It does.
Like, I picked the wrong.
So the problem is you have to decide the end of your 3rd year residency. You apply for fellowship, which is your last year of training specifically in this, and you're not going until 2 years later.
Yeah.
So you're signing a binding contract at the midpoint of your 4th year to say, this is what I love and this is what I'm going to do for the rest of my life.
Yeah.
And, I think the thing that happens is I have stayed in love with it. I love it. And
it's great.
I don't see myself changing, but, the practice changes, right? So, I don't think for the rest of my life, I'm going to be going in the middle of the night all the time or being on call 2 days a week.
Yeah.
But there's still trauma that happens, right? So there's still people who get hurt who come to your office. You can schedule for surgery. Eventually I get old enough to hire young people who really want to be there all the time, like me, who are ready to be there and kind of get the work done.
Yeah.
And then it also changes where you can do it where, people have had surgery somewhere else and it didn't go necessarily well or things healed in appropriate position. And your job is to actually, restore those things. So I still do that. That's part of my practice. Those are the things that I schedule as somebody comes in on, Wednesday and I'm like, oh, this needs to be done. You've been dealing with this for a year. When do you want to do it within the next month or 6 weeks or whatever on your schedule?
Okay.
Right. So that part of my practice still exists.
That still exists. Okay.
Yeah.
Which probably you kind of need the balance of the two.
You do.
Right? Yeah.
You do. But I think, and then the last reason why I went into this is because, I go to work every day and I take care of people. Doesn't matter whether you're black, white, non-insured, the worst insurance ever. Doesn't matter if you're, an illegal immigrant. It doesn't matter if you're visiting from another country. None of those things matter.
Yeah.
I go to work. I fix people. I do my job. No one's telling me I can't put people back together because they don't have insurance. I can, I take care of people who were in car accidents, who have gunshot wounds, who have, any person I take care of. And so, I'm never worried. Like every once in a while people ask, they're like, well, is my insurance going to cover that? And I'm like, I don't know. I just show up and go to work, man. Like,
thank God. I mean, everybody, we want people like you out there. Like, we need doctors who have that point of view. I mean, not all of them do.
But I think that, I think the hard part about medicine is that there are a lot of things that are immediate, and there are a lot of things that, are completely debilitating for people, but may not be considered to need immediate attention. And so those are the people who get hurt in the insurance.
Sure.
In the
and
insurance
it gets
issue.
kicked down the road, and then their condition deteriorates. Yeah.
I mean, and that's the thing that, I think for us, my partners and I have a great group of people I work with. Mark Veras is our chair. He's the trauma guy. Charles Moon, another trauma person. Carol Lynn, and Jeff Marisek, who are like our 4 people who are trauma surgeons who work at Cedars. And then we're hiring a guy named John Garlick, who was one of our residents who trained with us, and who somehow, some way we had that impact on him. And he decided to go into this crazy specialty and want to come back and work with us. Like, we all have that same mindset of just get the work done.
Yeah.
Take care of the people.
Yeah.
Do the right thing. And, I think that if you have people like that, it makes it easy to go to work.
Sure.
Right. It makes it easy to work with people and I'm not worried that like my partner's going to be like, oh, this guy doesn't have insurance. I'm not going to do it. I'm going to give it to so-and-so.
Yeah.
You know what I mean? That is never a conversation. It never comes up. It's never an issue.
Thank God, man.
And so I'm just lucky to work with the people I work with.
Well, I think we're lucky to have you. Before we get into the specifics of mine, real quick, I don't remember us, because we're about the same age, growing up with such a loud anti-vax contingency out there. Like,
I appreciate you bringing this up.
Okay, so
this is so critical.
Because here's the thing, as a kid, vaccinations were standard, and like anti-vax was like a fringe element. Like, you didn't really hear about it. Then, let's say 15, 20 years, somewhere in that range, there was like Jenny McCarthy got late, she was like kind of the big voice saying like vaccinations cause autism. That got a little bit of steam, but it was sort of somewhat quickly debunked. And basically, if you did any research, you would find that there was no medical evidence to support that. There was even one study that did support it that was found to be basically a false study, a garbage study. And so, I have kids. I'm very fortunate that they're healthy kids. And I know certain parents who go like, well, yeah, I know something happened that day when they got, and you go, okay, like I'm not gonna shit on your experience or whatever, but now there's this really loud like voice of, hey man, vaccines are bullshit, and like they're planting chips in your neck. I'm like, what? Like, so you're a doctor, right?
Correct.
So, okay.
Correct.
So what is your opinion on vaccinations? Maybe even specifically the COVID ones. But
so, I mean, in general, my position on vaccinations are that they keep people alive, right? Vaccinations have stopped polio. Vaccinations have, decreased, have stopped measles, except for in locations where people aren't getting vaccinated. Without vaccinations, people would die. And, I was one of that. You and I were probably both in that group of people who still had chicken pox.
Yeah.
Who people were like, yeah, go hang out with that person who has chicken pox so everybody gets it now and we get over with it.
Right.
So I wasn't in the chicken pox, vaccination group, but my kids are. And, they're never going to experience the misery that is sitting in a like calamine lotion bath and like having that stuff itching.
But they also won't experience the joy of scratching scabs off your head. That was always fun. You're like, oh, there's another one on my head.
Yeah. So, I'm all in on vaccinations. And I think that there is sad things happen to people, and, people have issues, people have complications in medicine. People have complications of birth. There are birth abnormalities. Like, we have to recognize that like being normal isn't really the norm, considering how many processes have to happen for somebody to have an uncomplicated pregnancy and birth and upbringing and childhood and,
Sure.
and that whole process.
Well, it's such a scary. I mean,
Exactly.
it's a scary process when your wife's giving birth. You're
Yeah.
like,
Like,
you
is
know,
this gonna?
yeah, you don't.
You're like,
know.
wait, is that what is happening right now? Yeah.
And then his head's all.
Yeah.
You're like, is his head like that forever? And they're like, no, it'll go back.
And so, when bad things happen,
Yeah.
people want a reason,
Yeah.
and there are periods where people will cling to something that they think is their reason for this bad thing happening,
Sure.
and that's why things gain steam, like you said.
Yeah.
And so, like you said, I can't fault somebody for finding out why something bad happened and why this was my experience and wanting to know the exact reason why, when a lot of times there's not an easy why,
Yeah.
right? Like there's millions of codes of DNA that say why this happened
Sure.
that, just was off like that. So that's just overall vaccinations. The COVID vaccination is just like the management and the care of COVID itself and the pandemic.
Yeah.
Once you politicize something as heavy as it has been, you're going to have anti-vaxxers who are clinging to something,
Yeah.
or not even anti-vaxxers, but just people who are clinging to a political decision to say that this vaccination is wrong because they were told that by somebody.
Sure.
Right? There's certain reasons why there weren't announcements made
Now
about the
there's-
former president getting vaccinated.
Yes. Yes.
Because that could hurt his base who may not believe in vaccination or support
Which
vaccination.
is crazy. Like, it's crazy that like.
I think, and when I look at people of color, I think there's this kind of argument that says, hey, people of color, black people are not getting vaccinated because of things like the Tuskegee experiment, because of, inappropriate sterilization of women, because people have been injected inappropriately
Yes.
with, and those things are all true. That is
Right.
that is a reason why some people have some fear of vaccinations. But one of the main reasons people of color aren't getting vaccinated is because there aren't vaccination clinics in areas where people of color live. Or the only way to sign up for vaccinations are to go on the internet and sit there for 3 hours and refresh your screen and press buttons
And hope
when
you get
people
a
have
text.
jobs.
Yeah.
Right? Where, you don't have the ability to be at home and refreshing constantly.
Right.
You're working 1 or 2 jobs so that you can kind of make ends meet.
Yeah.
And so people don't even have the option, just like the same reason people of color weren't getting tested at the same rates as white people.
Sure.
Right. And so, there is a component of people who are like, I don't want to do it because of this reason. I mean, and I
understand the general mistrust, almost specifically from the black community. If you look like at historical, absolute abuse. I mean, treated like literally like animals, like experiments.
I mean, that's
there's a
how
history.
all of the evolution of OB and gynecologic medicine, right, was performed on black women without anesthesia.
It's just a colorful
And that guy has a statue.
point in our head. Yeah, that's cool. Yeah.
So
Honor him.
So that's my vaccination thing. My vaccination thing is, if you haven't, get the COVID vaccination.
Okay.
That's the way we get back to normalcy.
And like, should I trust you or this guy in my Instagram comments? I don't know.
Instagram comment guy is probably pretty smart.
Pretty smart guy.
Probably a smart guy.
Probably
but
went to medical school.
Probably.
Yep.
But as physicians and being a first liner, and I'm not a first liner like the people who were in the emergency room.
Yeah.
I took care of people who broke bones, but also had COVID.
Yeah.
But, I wasn't every day in the middle of the emergency room like that. That wasn't my job. And thank God.
You could probably, like somebody, like I said, not that smart, not a doctor. One of the things that makes sense to me to look at, and I saw a doctor write about this, was look at stats with no vaccine.
Exactly.
So here's none. And then with the vaccine. And it's like, look at hospitalizations and deaths with no vaccine and then compare it to with the vaccine. And like, that's a pretty good, easy way to balance the numbers, right?
It is. And I think the hardest part is we're at this point where we're right on this scale where things are getting so great that people are like, I'm going outside. I'm going to go to the club. I'm going to go to the bar. I'm going to do all of these things. And what you're not realizing is there are a lot of people who are vaccinated, but not enough.
Right.
And so you may be going to these places and there may be a lot of people who aren't vaccinated and who are there, but they're just living up because the state kind of released mandates.
Sure.
And so,
well, I just read two things. We need between 70 and 90% of the population to be vaccinated in order to have like herd immunity.
Yep.
And the second thing I read that was like kind of scary was that there's an increasing number of people who are not getting their second vaccination shot, and they're trying to like encourage people like if it's a two-dose shot.
If you get a single dose, you're only 50% protected.
Yeah.
So.
Okay. So cool to have a doctor weigh in on it. Now, okay, now we can get to the good stuff.
Now this is the most important part of it.
This is the most important part. So you show up at the hospital and you're like, great, one of the Lakers hurt himself. And so you come in and you realize it's not me. Now, one of the things I told you, you came in, I don't remember if you knew what had happened at first. I didn't know.
I didn't know what happened.
Yeah, you just knew about you see.
I heard this. I heard he was playing basketball.
Okay. And then I remember I was sitting with you where you came in and I was like, yeah, I actually have it on video. And you were like, oh, I'd like to see that. And then when I showed it to you, you were like, I don't want to see that again. And I was like, what? And you're like, dude, that was nasty. I was like, you're a doctor. What are you talking about? You're like, that was gruesome.
But I was like, I was like, can you send it to me? Though?
Yeah, I did. And I did. I sent it to you. So one of the things I've had like you recommended brilliant PT, Karen Gilbert.
Yeah, she was great.
She's told me numerous times, she goes, these are gnarly, bad injuries you have, like really bad. Yeah. When you see them as the surgeon, what hits you immediately, like when you see the two like pretty severe injuries, right? So,
and I would actually say you have three severe injuries, right? So like, I hear the story from the rest. So this is what happened. So I think you came in on a Monday or Tuesday.
Well, I got injured December 1st. And I was there December 2nd.
Yeah, so whatever days they were. I remember
Tuesday or Wednesday.
I remember meeting you and then telling you I'm gonna do your surgery 2 days later. Yeah. And you being like, 2 days later?
Yeah. Well, one of the residents when I was in the fast track, he was like, he was like, oh, the knee. He goes, yeah, the arm. I don't know. We might do it in a couple weeks. And I go, what the fuck are you talking about? In a couple weeks. And he was like, what? And I go, I'm not waiting a couple weeks. I mean, I don't know what I'm talking about, but I just got freaked out by it.
So you see both injuries, or three injuries, right? So you had a patellar tendon rupture, you had a humeral shaft fracture, and you had a radial nerve palsy. And the radial nerve is one of the nerves that helps you extend your wrist, extend your fingers, kind of, and make a thumbs up, right? Like, and it's getting there. You're back.
It's getting there.
Oh man, but those are like three bad injuries, right? And I think the thing that gives me the most concern, honestly, is a radial nerve palsy.
Really?
That was like the number one thing where I was like, number one, because it comes back 70% of the time, but you just don't know when. For some people, it comes back at 6 weeks. Some people, it comes back at, 6 months. Some people at 2 years. Some people need to have surgery to get like their function back. So you just don't know. Like a humeral shaft, you put the bones together, put metal plates and screws, and it heals like 95% of the time.
So is that kind of like the easiest to fix of what we?
It was probably, well, I mean, looking at it, it was probably the most straightforward in terms of, you can, and we talked about it. I was like, you can treat this without surgery.
Yes, you did tell me.
And that requires you to wear a brace, come back and see me every week, and like you can't use crutches, you can't do these things. So I was like, for you having a knee injury, it makes it almost impossible to treat it non-operatively. And, I think surgery is the best thing for you. Yeah. The patellar tendon, in general, it's a pretty straightforward procedure.
Can you pull up that image, the patellar tendon image? So one of the things I remember you telling me was that you told me that I ruptured my patellar tendon in an unusual place.
Yeah.
Like most of the times it ruptures at where it's connected?
Yeah, so if you look at that little ball on the front, like this is a side view of the knee, and that little ball on the front is your kneecap.
Which is in the wrong place?
So it's sitting really, really high.
Yeah.
It's sitting a lot higher than it should be. most of the time when you rupture your kneecap, or when you rupture your patellar tendon, it comes just off the tip of the kneecap. So if you go to the next, I guess 2 picture, or go to the MRI picture. So if you look at the MRI, like the resident was like, you know, they mentioned the ultrasound, and then the resident's like, yeah, the ultrasound says that it's ruptured in the middle of the patellar tendon. And, you know, all of us are in conference. So me, you know, all my partners, we're sitting there and we're like, that never happens. It never happens. What are you talking about? And he's like, no, that's what it says. And then we get the MRI and we look at the MRI and we're like, it looks like it ruptured in the middle of the tendon, or at least, you know, you see how that thing is like folded, that little black line that's folded. Yep. That right there, that should just be a straight line going directly to the tibia.
So that's the tendon.
Yeah, so that's the tendon.
Okay.
So I'm like, that's weird. And then we get in the operating room and we open it and it's ruptured like right in the middle and torn from like the top part of the tibia, like right from that edge. And I was like, okay, this is not what I was expecting. You know, it just makes me have to think about it and fixing it and repairing it in a different way.
So when you looking at this now, what is your approach then to repair it?
Yeah. So the approach to repair it. So normally you make some drill holes through the kneecap and you pass stitches through the kneecap and you tie them over the top, and that just repairs that tendon. This time we had to kind of pass stitches through the tendon and then put drill holes in your tibia. And pass those stitches around and tie them there. And so it's just the opposite of what we usually do. So that I've done that. I've had to do that twice in my career.
Wow.
Yeah, it's just rare.
Does the fact that it happened in the middle inform you in any way, or is it just incidental?
It's probably just incidental.
Okay.
But the main thing it kind of informs you of is that, you know, maybe you didn't have a lot of times when people tear their patellar tendon, it's because they had some tendonitis, like either at the top or at the bottom of the tendon that's been there for a while. And so it speaks to how much force you were able to generate.
So I'm super strong.
So you're super strong. Yeah. That's it.
Because I've been saying that for years.
So, yeah.
I mean, you know, the thing I've told people this, you know, they don't it's hard to communicate all the feelings and thoughts that you have when something like this happens. One of them is that you're like, we were just having fun. like we were having a good time that day, you know, like we played basketball first.
Yeah.
And then we went and did this stupid dunk thing, which is 100% my fault. and we're just like doing it increment, like 7, 8, 8.5. Like we're just like having fun. And then I felt like, I was like, did I just get shot? Like I felt like a fucking car hit me or something. Like it's so unexpected. Yeah. There's like a shock element to it happening, you know?
No one expects to do that, right? Like
no.
I was talking to a friend of mine, and he was talking about when he tore his Achilles. He was like, yeah, I just started to run real quick.
Yeah, and it just
I looked behind me, I thought somebody kicked me in my leg.
Yeah.
And they didn't, but yeah, it's just.
I wanted to be like, when I was laying there, I was like, who took my legs out from under me? Like,
I was like, which one of you?
Yeah, I was freaking out. Now, how much, because I never actually asked you this, was me carrying so much weight a part of this? It could have been, right?
Yeah, definitely. I mean, it impacts you. I think that's a conversation that I have with all my patients. It's like, well, my knee still hurts after blah, blah, blah. It's like, well, you could lose some weight and it'll take some of the pressure off your knee and it will help. So yeah,
how often do they
listen to me?
Yeah.
No one listens to me. My kids don't listen to me. My wife doesn't listen to me. Nobody listens to me.
I listen to you,
My patients don't listen.
I listen to you, man.
Okay, Mr. Bench pressing 350
well,
pounds.
Okay. Okay, all right. We'll get to that. Hold on. I forgot that one. Your face that day was great. So, all right. So let's get through these first. Hold on. Fuck, I forgot about that. So this one, all right. So this is an incredible image, by the way.
So that's that, right? So, and then I think if you go to the next MRI picture, so just see how it's like all bright white.
Yeah.
That's just like sadness, right? And the bright white is like fluid and bleeding, and so that's all it's doing is showing us. You know, this is bad.
I talked to the PTs are fascinating. I have a friend who was also a PT, and he was asking me. He goes, "Did you not feel pain in one place, and I was like, yeah. I go, I didn't feel pain in my leg, knee area until a few days after surgery. Yeah. Like before surgery, I was like, all I felt was this arm. The pain was so intense.
That's just because the arm is miserable.
Yeah.
It's miserable, and like you also had on like a coaptation splint, which is like the worst splint ever. It goes up to your neck. Yeah. It's massive.
Yeah.
And then even though it's supposed to like keep you sturdy, every time you move your arm wrong, you feel the bone edges go click,
it's so
and
painful.
It's miserable.
It's so, and I remember too, they would like give me drugs, and they'd be like, "How's your pain?" I'm like, "The same. What are you talking about?" Like it's never getting better. It does. The pain is not until I got Dilaudid. That shit's nice, nice. Now,
you're not the first person to tell me that from a patient standpoint.
I still remember that nurse going, a lot of people say you feel a warm rush in your chest. And she gives it to me, and it was like 3, 2, 1. I was like, oh. I felt like fire in my chest. I was like, oh, man, drugs are good. What's the next image we have?
Go to the, here, why don't you, I guess go to the patella like afterwards. Or
this?
Or you can go to this, yeah.
I don't know. What is this?
I think that one, go to the, I think there's an x-ray of the humerus beforehand.
Yeah, there's a before.
It's just after the knee x-ray. Yeah, there you go.
So that's what my arm looks like.
Yes. So that's what your arm looks like.
That's a pretty clean break.
Yeah, it's clean-ish, right? Like to some extent it's clean, and then there's like these little fragments which are miserable.
Yeah.
Like they're not small enough to put screws in.
And then you clean those out? Like you just
some of them you take out. Yeah. The ones that aren't attached to anything, you have to take them out, or they can be a problem. And then some of them, they just kind of stay in place and help to.
Now, one thing I do remember clearly is, I'd met with you in the room, and then, you're like, I'll perform surgery tomorrow.
Yep.
And I remember a resident coming in, and I was like, oh, where's the incision going to be? And he was like, oh, it'll be along your tricep. And I was like, okay. Then I woke up, it's on the bicep.
Yeah.
And I was just curious, like,
there's
was
two
he
different
wrong?
ways. Oh, no, there's two different ways to do it. And yours is right on that junction where you can either do it from the backside on the triceps, or you can go from the front. And just kind of location-wise, the fact that it was a little lower, I made the decision to go to the front side.
Okay. And then one thing I was curious, you cut through the muscle, I guess, right? Or no?
So you kind of spread, right?
Oh, you do?
You spread. Okay. There's one little muscle down on the bottom that you have to cut, that you have to kind of spread through. But you spread through it in a point where there's nerves that come in from both sides, and they're two separate nerves. So you work through that area in between them. So I know it's nuts. It's bananas. It's like all these things.
It's so crazy that you do this. Like, I mean, also when I see the images afterwards of like the plate, if you can go to the next image, like the plate with screws in there, and you're like, how do you get this in here?
Yeah. So like the first one we put in just to kind of hold things in position. You can see that little piece on the side, and then you can go to the next one. And that's just kind of holding that little piece in place. And then you can go to the next. Then we put a big plate that actually allows us to really kind of protect your arm. And so that's the next one.
Oof. Yeah. So that's in my. And by the way,
that's in your arm. Yeah, that's the front side. Yeah,
this stays, right? This will never
stays forever, unless you really want it out. Yeah, you don't have to have it out.
Some people have told me that in some cases a body will reject. I mean,
some people have pain, or some people don't really like the idea of metal in their body.
Yeah.
And there are some places that are really, really like superficial. And so when you have metal there, like a clavicle, it can be irritating, or like right on the elbow. And so people want that metal out because it hurts, right? So you lean the wrong way, you put a backpack on or something like that. They want it out. But this is covered by muscle. It's like, it's in a place where you shouldn't ever need to have it out.
Yeah, I don't think I want it out.
No, no, I don't think so.
No, and I think that would suck to get it out. Now, you told me also that, I could have had a severed radial nerve or damaged, but it wasn't.
No, the nerve was intact. We kind of checked it at the bottom. We checked it to make sure everything was intact, and and that's a good thing, right? So that's why things are starting to wake up and things are starting to come back.
Yeah, it's starting to get there. I also told you, I tell you this in person, but I was like overwhelmed emotionally in the hospital and in recovery at how I just felt like fortunate, like so lucky. You're talking about like clinics being in not in certain areas. Like I was like, I'm so lucky that first it was the doctor who told me about you goes, this is like when I'm like holding my arm, And I have a brace on. He's like, oh, well, you're lucky. And I was like, excuse me?
Yeah.
And he was like, well, he literally goes, you could have landed on the back of your head and you'd be speaking with a slur for the rest of your life. And I was like, okay. And he just get over to Cedars. And I was like, okay. And so that was my first dose of You're Lucky. But then I got overwhelmed. Like I was in the fast track and I have my friend Bert who's with me. And I'm like so grateful that he stayed with me. This is the first time where I was like, I usually do like, things alone. Like if you're like, I'm going to come with you, I'd be like, I'm good. And I really wanted someone with me, you know? And I was grateful for that. Then I was like, I'm so lucky that I can get first class medical treatment, lucky that I got you to perform the operation. And I felt extremely grateful for that. And then I told you, I was like, I never really felt like I had a real appreciation for all the other people in medical, like for instance, nurses, right? Yeah. Nurses, I think if you're a generally healthy person, your interaction with a nurse is like you see your physician, your nurse has your blood pressure, maybe draws blood, which is not unimportant, like it is, but you go like, what do you think of nurses? You're like, they're great. I'm glad there's nurses, But like when you're in the hospital and recovery and you're having nurses tend to your every single need, like, I've tried to explain that like I couldn't do a thing. Nothing. I couldn't reach for it like this. I could, and they're like, I mean, making sure you're comfortable, you're fed, you're bathed, you're clean, you feel overwhelmed with the and then the food runners and people, making sure you're okay. That whole experience was very overwhelming.
I think that, I'm lucky, the 7th floor OR staff, the nurses, the surgical techs, the the EVS or the environmental services who clean the rooms and kind of turn things over. I work with phenomenal people who appreciate their job.
Yeah.
And appreciate their importance.
Yeah.
Right? Like how important every single person is to making the system work.
You need to have them all.
And then, the 7th floor nurses, 7 North nurses who, and kind of the managers and kind of, once again, the environmental services people who clean your rooms, who change your sheets, who like the food people who bring you your food. Like every single person is so critical to kind of like making sure that experience for you is not miserable.
Oh my God.
And all it takes is one person to make it miserable.
Yeah.
And like, you're like, oh man, this is the worst thing ever. And I've been admitted to a hospital and like the morning, like 4:00 in the morning, someone comes in and they go, hey, I need you to get out of the bed and I need to weigh you. And I'm like,
now?
At 4 a.m. He's like, yeah, I was supposed to do it last night, but I didn't. But I got to do it. But like, it's part of everybody's job, right? So like for me, it's like, God, this is a pain in the butt, but I got to get up, I do it. And, I know that this guy didn't want to like wake me up at 4 a.m. Like the last thing he wanted to do was wake me up at 4 a.m.
Sure.
and so that he doesn't get in trouble for that. And so, when you're admitted to the hospital, part of it is everybody is literally going out of their way to make things as good for you as they possibly can.
Yeah.
And when things aren't good, please just recognize that the person who is making it not great for you is very sad that that's your experience, and they don't want you to kind of feel that way.
Sure.
And so that's my disclaimer for like hospital staff and kind of being admitted and kind of going through that process. But like you say, it is, they do everything for you, like every single thing.
Yeah.
Even the most like embarrassing things.
Yeah. Yeah, they do, which like, it's humbling and it like, you just, I would openly weep about this. Yeah. Like I'd be sitting in my bed alone. Yeah. Sometimes it would be 2 staff, and I didn't understand why that was happening either. It was overwhelming though.
This is a conversation I have with my patients all the time, right? So like,
you must see that, right?
Oh, constantly, right? Yeah. So post-traumatic stress is a very, very real thing. And I have to bring, like, when I operate on, so somebody who breaks their pelvis, right? In a car accident, I have to talk to them about breaking their pelvis, the fact that they're not going to walk in 3 months. I have to ask them, when they come back, are you getting erections? Is your sexual function working right? Are you, are you having nightmares? Are you remembering these things? Are you replaying this? Can you get in a car without feeling like overwhelmed?
Wow.
Like these are all the conversations that we have. And, I think that we as a people focus really, really heavily on like the cool x-rays and the cool injuries.
Right.
But I think for you to say that, I think is really important for people to understand. Like it is completely normal to, when you undergo something like this, to be emotionally overwhelmed.
Yeah.
Right? Because you think about this, it's like, well, am I going to be able to walk? Am I going to be able to stand and do a show? Am I going to be able to move my fingers?
Yeah.
Am I going to be able to hold my kids? Am I going to be able to play sports with my kids?
Yeah.
Am I going to be able, like, there's thousands and thousands of things running through your mind. And like, to be overwhelmed is completely normal.
Mm-hmm.
And completely like, I think the important thing is that you tell somebody that you're overwhelmed.
Definitely.
And like, I think we talked about it. I was like, well, if you need to talk to somebody, we can get you like a recommendation for that as well. Because I think that's, for a lot of people, I think there's this stigma on, I don't need to see a therapist.
Yeah.
I can just muscle through this.
And other people just go like, you broke your arm. What's the big deal? And you're like, it doesn't, that you're not helping. Like, you know what I mean? Like,
but the arm's fixed now, right?
Yeah, they're fixed. Like,
it's fixed.
And you're like, that's not, but it's not about the arm breaking. It's like, it's the entire episode, right?
Yeah.
It's like the whole thing.
It's the admission to the hospital. It's the like lack of independence. It's the like the financial, right? Like I have a family. How will I pay for my family to eat food?
Sure.
How will I pay my mortgage? Like all of that stuff is real. Like,
it's in your head the whole time.
When I have to tell somebody, hey, well, you're not going to be able to walk you're not going to put any weight on this leg for 3 months. They're like, well, I have to go to work. It's like, I was like, well, what kind of work do you do? Well, I do construction. I said, not now.
Yeah.
Not right now. Like you had about 6 months before you're climbing on the roof, my friend.
Yeah. And the other thing is like, dude, there was people who were there, like they message you and they go, I had like similar injuries. You'll never be the same. And you're like, what?
It's so true.
And then you go, what are you talking about? And the guy's like, yeah, I still can't feel my hand and this and that. And I go, really? And he goes, well, I never did any of the PT. And I'm like, what the fuck are you telling me this for then, man? Like, why didn't you do PT? He's like, I don't know.
I didn't feel like it.
Yeah. And you're like, okay. Yeah, because, one of the, my friend Krista Stefano is a very funny comedian, was a PT before he became a comic. He was telling me all things like he knew.
Yeah.
He goes like, did you, you get real emotional about this and that? Yeah, he goes, you feel like intense bonds with like your caretakers. And I was like, yes. And then he's like, do you feel like parts of your personality kind of shift, like almost like break out of your shell? And I go, yeah, and to a degree, yeah. He's like, I saw this all the time. Like, and he would explain to me that like you just, he said like some people like personality wise had like a complete shift after their injuries.
I mean, I learned so much from every single patient.
Yeah.
And it's like everything that happens in life, right? Something happens bad and you can either, like, it's the old two roads thing, right? You either like rebound from it, get better, and you're like, I'm going to recover.
Yep.
I'm going to work through the hardships and the difficulty, and like, I'm going to get back. Or you're like, I got hurt. This sucks.
Yeah. And
I'm never going to be the same.
Yeah.
And you shrink.
Yes.
And like,
you told me one of the first things, you're like, you'll play sports again.
Yep.
You're like, what do you like to play? I was like, oh, tennis. You're like, yeah, you'll play tennis. You'll play, like it'll just take time, but you'll play again.
You have to believe that you can do all those things.
Yeah.
If you don't believe it, if you have any doubt that you're going to do it, you're not going to be able to do it.
Yeah.
And I think that the thing is that for most people, they will be able to do it if they do the therapy. If they push themselves. Now, are you going to be as good as you were before?
Yeah.
I hope so. If you put in the time and you put in the effort, you will be. But when you start doing it, you're like, well, I run funny, so I'm not going to run anymore.
Yeah.
Yeah, you run funny because you haven't run in 6 months.
Sure.
Like, you have to learn to do it again. So it's going to take you 6 months to run again.
You also gave me I mentioned her, but the best PT, Dr.
Karen was great.
Karen Joubert,
Who great.
Uses very colorful language, and but really pushed me, but like was the best balance of like pushing me, supporting me, really helped rehab this whole thing in an incredible way. I mean, really, really incredible. And she she's just so well, like all this stuff is just like you operating as her PT, you know,
Yeah.
like to train, like
Yeah.
she just knows right away what to do.
Yeah.
It was great. It was great, man.
Good.
An amazing experience with her.
I'm glad that we're.
So the only time I kind of ignored you, I didn't really ignore you. I just
Well, you did.
Well,
You did. Well, I'm going to take. I'll take some credit for that. I said you are now weight bearing as tolerated. I said that.
yeah.
I did.
So here's what happened. So you told me you can lift up to 15 pounds.
Yes,
and
correct.
I thought that meant
300
no. I thought
and 15 pounds.
no. I thought that meant like curl, like with the arm.
Yeah.
So what happened was my buddy Sean came over, who trains me, and he's like, I go, we can only do 15 with this. He's like, what about with deadlifts? And I was like, I don't know. And then he was like, what about bench? I was like, he didn't say anything about bench. So we were benching, and I remember that I was like, man, this fucking hurts. And so I saw you the next week, and you're like, how is everything? And you have the mask on, we're in your office. And I go, everything's pretty good. I go, I have a little bit of pain here. And I go, I noticed it a lot after I benched. And you went, what do you mean benched? And I go, bench press. And you're like, I know what a bench press is. I go, yeah. You go, how much are you benching? I was like, not a lot. I was like, and you go, well, what's not a lot? And I go, I think we did like warm up weight, man, like 135, and then we got 155 or something. And you're like, you are cleared to lift 15 pounds.
I mean, you have to like show I guess the final X-ray of his humerus, like the last one, and you know you're 6 weeks out from surgery.
Yeah.
You're not like 3 months out. Like when you come back bench pressing, it's your like 6 week or your like 8 week visit.
Yeah.
And I'm like, I didn't approve you for that.
I know.
And Karen gave you some colorful language after that one.
She did. And then I gave my trainer colorful language.
Yeah, because I can't yell at you, and I can't really yell at my patients and cuss them.
Yeah.
Cussing them, sometimes, like, some people need it.
Yeah.
Like, some people some people need it. Like, I didn't think you needed it yet.
Yeah.
Yet.
But mine, in my defense, mine was from stupidity. It wasn't from trying to ignore. I was like, I'm dumb, and I didn't register the instructions.
Yeah. So, you know.
You can't be mad at stupid.
No, it's fine.
You just pet my head and go, do better.
Do better.
Yeah. Fuck. Yeah. All right, but I did lose weight.
You did. You lost a bunch. Like, every time you came back, I'm like, you're shriveling up.
And then
man.
you started to shrivel. I'm like, what are you doing, man?
Look, man. It's my ritual in January. I gotta lose weight.
You do that every January?
Now, I mean, it's 2 Januaries in a row, I should say. Yeah. So I looked at I got on a scale, and I'm like, oh, like I've never weighed over 200 pounds. Mm-hmm. So look at the scale. I'm like 199. I'm like, uh-oh. So like I just like started exercising.
Because you looked notably different.
I'd started exercising hard. January 3rd went like 3 months straight, pretty aggressively, and I got down to like 179, 180. I'm like 185 now. So I'm happy with it.
Good.
I'll stay here.
Good. That's great, man. Yeah, I'm still going. I'm down 32 pounds now.
Good Lord.
And I'm gonna try to keep going because I want to get. I don't want to say the number because then people like tell. They're like, here's what you should weigh. And I'm like, who asked you? I didn't ask you anything.
That's no. 185 is I still am fat on the BMI scale.
Yeah. Well. Are we ever gonna do away with that thing?
We need to change it.
It's like it's a 70-year-old or 100-year-old like. All right. So, from here. I know I have a little nerve test coming up.
So, I mean, I think the biggest things for you is the bones are healing slowly. The patellar tendon is great, right? You said you're doing almost everything you want to do. You got a little brace for it.
Yeah. There's a little tightness, but I mean, I feel like at this point that makes sense, right?
Yep. And it keeps getting back. I mean, your range of motion is great. You're almost back to full range of motion.
Yeah.
Probably at full range of motion. So we do a nerve test to see where the nerves are right now because they're improving. Like, you guys have to understand, I mean, and he's talked about it, his arm was dead. Like he had he couldn't make a thumbs up.
I would just pick it up and it would just drop.
Yeah. So, you're huge, way advanced from that standpoint. And so we'll have, after we do the nerve test, we'll see where you're at. And then I'll have one of my nerve guys see you, a guy named Mitch Saruya, who's a plastic surgeon who does kind of nerve and kind of tendon reconstruction if the nerves aren't recovering fast enough. So that could be necessary if things aren't going fast enough or he feels like you're behind a little bit. So that's kind of the next step.
Okay.
So, like we talked about, the hope is that we don't need to do anything.
I hope so, but the saga continues. I don't know what's going to happen.
Exactly.
Well, look, man, I just wanted to say I am eternally grateful that I met you, that you were my surgeon, that you operated on me. You're a wonderful guy. And I'm so grateful to have you as my doctor.
Well, I appreciate that. It's a pleasure taking care of you. There are certain people who make it pretty easy.
Yeah.
And they make, you have these clinic days where you see patients, and like, you have these days where everybody's in a good mood and happy.
Yeah.
And they may have had terrible injuries, but they're doing really well. And like, the day moves relatively quickly.
Yeah.
But that's a good thing, because people are like, they're just there for kind of to catch up. And, like I tell my patients, you're at least stuck with me for a year.
Yeah.
And, you got my cell, so I guess you're stuck with me forever.
I text you all the time.
Exactly.
Yeah.
So, if you need anything, obviously.
I appreciate it, man. And I will dunk again, right?
Yeah.
Okay.
Yeah.
Okay.
On like 7.5.
Come on, man.
We got to get you, we get you to 8, probably 8, maybe 8.5. What, you're on 9.2 when it happened?
9.3 is when it happened. I cleared 9.
Okay.
So I'm, the goal is obviously to get back to like 10.5, 11, something like that.
Perfect.
All right. Dr. Milton Little, thanks so much.
No problem. Thank you. Thank you for having me.